Hi, I'm Tracy Wanger. I'm going to be talking about the discussion and findings and the limitations and also recommendations for practice of hourly rounding. So again, like Larry mentioned, patient satisfaction and call light usage were most impacted by hourly rounding. But as far as falls, there was only a 50%. 50% of the studies indicated a statistical significance. So we definitely need some more research relating to whether the hourly rounding process decreases the hospital-acquired infections, pressure ulcers, and falls. I mean, a lot of these studies hint at, a multitude of factors, of outcome indicators, but there's really not enough evidence available that's showing that it's significant, that hourly rounding can reduce these pressure ulcers and even improve the satisfaction and the nursing satisfaction. So again, with limitations, these studies they're not really long enough. A lot of them were under a year, even some of them were like a couple of weeks. They need to show a little bit more longevity, and they need larger sample sizes. And we also need a better definition of these outcome indicators so we can really measure if hourly rounding is successful in reducing these hospital-acquired infections and lowering the call lights, etc. The other thing is that there's really, even though the call lights are reduced, there's really no correlation as to whether or how that's actually impacting patient satisfaction. And the HCAHPS scores, which determine Medicare reimbursements, are really, there's not a real clear correlation as to how the practice of rounding is impacting this patient satisfaction, or what areas of the HCAHPS it's really improving. So there needs to be a little bit more research, and perhaps a qualitative studies on patients' perceptions themselves as to the process of hourly rounding. See what these patients think about the process. Maybe we can get a better idea of how we're actually improving their stay in the hospital. So as for some recommendations, it's definitely a hard process to implement in the units and on the floors, because the nurses a lot of times are apprehensive it's going to cause more work for them, and how are they going to do this. So there was a study recently done by Dietrich in 2012. It said you need to really educate your nurses about the process itself, what it means, what the purpose is. You need to have rounding champions or rounding leaders to check people off on their skills. There should be a script. There should be like a sample log that you sign off, and you really need to hold your nurses accountable to the practice. And also, when you get results that about improvement in any of the areas, the outcome indicators, you really need to relay that information to your nurses so that they understand that this is working and there's a reason to continue doing this. Otherwise, the commitment is going to be limited to the process. And that's pretty much it for our presentation. Thank you.